Hello all, welcome to CARE Samvaad with me, Mirchi Hemant, and ee roju naatho paatu unnaru Dr. Johann Christopher. Sir, so nice to have you. అంటే హార్ట్ రిలేటెడ్ క్వశ్చన్స్ మేము సినిమాల్లో చూసో లేకపోతే బుక్స్లో చదివా వీ హ్యావ్ లైక్ లాంగ్ లిస్ట్ ఆఫ్ క్వశ్చన్స్ అండ్ మోస్ట్ ఆఫ్ ద పీపుల్ ఆన్ ది ఇంటర్నెట్ ఆల్సో గేవ్ అస్ అ లిస్ట్ ఆఫ్ క్వశ్చన్స్. సో ఐఎమ్ గోయింగ్ టు హ్యావ్ ఆల్ దీస్ క్వశ్చన్స్ రూటెడ్ టు యూ. You have to answer all of them patiently, sir.
Happy to answer.
Right. So first thing is, these days we see a lot of cardiovascular diseases like popping up every day. Too much of this news happening around us. What do you think is the major reason for that, doctor?
Obesity. Obesity is fueling a huge crisis. Our extreme tendency to eat junk food and inability to do exercise because of lack of infrastructure, and obviously our ancestral genes, which has been there to store, is now fueling this huge crisis. It's a crisis that was waiting to happen, but because of media exposure, now it's all out in the open.
Does it come back to bad lifestyle again?
Absolutely. It starts there.
And also, doctor, these days we hear a lot of words like cardiac imaging in hospitals. Please explain this to us. How does this work? How does it help in regards to fixing the problem with regards to heart?
Yeah, so conventional techniques don't pick up heart attacks early. We know that heart attacks are a big problem, and we know that once a heart attack happens, or for that matter a stroke happens, there is muscle death which cannot be revived at any cost. So we want to prevent the event from happening before it happens. It's something like Sherlock Holmes. So cardiac imaging is using a microscope virtually to check something that is going to happen in the future. So it's almost like the movie Back to the Future.
All right. And also things like, say, the CT, angiography, and, all the other technological advancements that have come in the medical facilities. You think this help in sorting the problems with regards to heart?
Yes, if it is used diligently, if it is used as per the guidelines, if it's used by a trained operator, and also as part of a heart team, certainly judicious use of these techniques will definitely prevent heart attacks and allow people to enjoy life in their fullness without having to worry about having the next heart attack.
For a layman like me, words like Atherosclerosis sounds very big and fancy. Please, simplify that to us.
Yeah, atherosclerosis is nothing but deposition of cholesterol in the wrong place. We know that cholesterol is a good thing. So we eat cholesterol, the body synthesizes cholesterol. Cholesterol is very important for a lot of processes. But when cholesterol gets deposited in the heart vessels and choke the supply to the heart, then it becomes a danger. And it does that because of our bad lifestyle and the wrong cholesterol that we have.
Does the imaging that we were talking about, is that helping in early detection again with regards to this?
Absolutely. So as I said before, conventional wisdom, conventional techniques have not been able to arrest this huge, I would call it, epidemic of atherosclerosis. So we have to think out of the box. We have to use tools to look into the arteries so that we pick them up early, and we have excellent drugs right now that can partially reverse these processes before they end up with a heart attack.
Doctor, I understand with regards to heart, one has to be really careful, follow all the medications like doctors like you are advising and writing for us. But my question is, beyond medication, is there any other interventions that can help us in detecting or sorting this issue further?
Yeah, actually, much before medicines, what we actually promote as physicians is lifestyle modification. We call it LM, or lifestyle modification. And that basically involves a gamut of diet, exercise, and decreasing stress. I would call it a whole new algorithm. You want to stay healthy, you eat the right things, you enjoy food, but you eat the right things, you eat it in the right quantity, you do the right exercises, you don't overdo it, you don't underdo it, and most importantly, you learn to be patient, think comfortably, and avoid mental stress. In fact, mental stress is what I call the matchstick which ignites a gas cylinder.
Sir, isn't mental stress like an everyday's problem now?
Yeah, but stress is there for everybody, but we have to learn to manage it. Holistic management of stress is going to be very vital for us.
And also, doctor, pardon me, but the number of rights that you've said, right sleep, right food, right exercise, isn't that the whole problem, being righteous all the time?
Yeah, So when you're not right, that's when wrong things happen. So if you want to prevent wrong things, you have to put in a lot of effort. It's not an easy job, but our grandparents and their grandparents did it very easily. So I think it's time to just hit the reset button and go back and see what these people did right and why they lived to 80, 90. And although we can't do everything the same way, but I think there is a certain amount of effort that we have to put in, hit the reset button, and start thinking and doing things simply.
All right, doctor. I mean, now that you are a heart doctor, I just want to understand. Please tell us what is your lifestyle like, because the kind of schedules, work schedules that you have, the kind of pressures that you have, I am sure you have more than all of us put together. So how do you handle your lifestyle? Please walk us through that.
Yeah, I think it all comes down to only one thing, and that's discipline. So we begin our day very early. So before things start happening, we are able to get up, we are able to plan the day, we plan the sequence, we plan when the sickest patient has to be done, who needs to get done first. And when you get up early, then you start having time. You're ahead of time actually. And your mind is able to compartmentalize things that have to be done urgently, things which have to be done importantly, and things which can actually wait. But when you don't get up early and you don't have a refreshed sleep, things start hitting you from all over. And again, you're the most brilliant guy in town, you're not going to be able to handle the stress. So I think part of the thing is having good sleep. A well-rested mind is able to sit back, look at things and sort them out. So I think that's one of the biggest advantages that we have is discipline and the ability to get up early, have a good night's sleep, and then start our work early. And I find that a lot of things fall into place simply because, not because of technology, but we are there on time.
So you think people like us are not sleeping early because we have phone in our hands that has social media on it and we keep on scrolling it? You think that's the basic problem?
I think nights, God has designed, I believe in God, and I believe that God has designed nights so that we can close our eyes. Okay, not to keep the lights on and the phone on and things like that.
But Instagram we have to see, no?
Yeah, but you can see that in the daytime. Nobody's stopping you. So I think nights are, the problem here, which is very fundamental, is that the brain does not produce its own glucose. It is like a landlocked country which depends on another country for the port, usage of the port. The brain, unlike any other organ, does not manufacture glucose. It's completely dependent on glucose from outside. So if you don't give time for the brain to recharge and get the glucose from a neighboring organ which has a port, like a landlocked country, the brain is going to be starved of glucose. And when the brain is starved of glucose, stress comes in. Because with limited petrol, you're trying to do a lot of things, and they're not going to happen. To have a full tank of petrol when you start work is one of the best things that I like when I get into my car. So also a well-rested brain is like a tank full of petrol. When you have a tank full of petrol, there are a lot of options that come onto the table, which you can exercise very comfortably. If you're driving on reserve all the time, you're going to be very, very edgy on the road.
Oh yes, this is clearly understanding now. And also, doctor, we all say that the body is our friend, we have to take care of it. At the same time, before it jumps out saying, okay, there's a heart failure, I'm sure the body gives enough and more signals. We tend to ignore that. Can you tell us what are those signals that the body gives out?
Yeah, the signals are many, but I think what is very important is that regular systematic health checkups, which is well set in the Western countries. The moment you cross 40, they have very systematic health checkups that are done yearly, quarterly. Their companies insist, the schools insist, the universities insist. We don't have any kind of a system. Everybody does whatever they want. So by the time, because most of us are not health literate, I would say, and we depend on WhatsApp University for most of our knowledge, which is erroneous most of the time, we are approaching the health provider much later in the duration of the disease. And by the time, a lot of damage has already happened. And then to reverse that requires more money, more time, more effort, and the recovery most of the time is incomplete. So we have to revise our timelines and start being proactive. In India, generally, we are very a reactive country. We don't want to strengthen our infrastructure. When the next pothole happens and someone goes into the pothole and unfortunately has a demise, that's when we start looking at the contractor. But if we are able to proactively check that contractor and before the road is opened, do a test and make sure the guy has done his job, that pothole is not going to happen. So we are basically a reactive country. We react to situations, we react to terror, we react to epidemics. We are not a proactive country which lays down infrastructure, spends money, millions and billions of dollars on infrastructure to prevent that one event from happening. So also just like our country, since we are also part of the country, we are very reactive. When we have chest pain, we go. When we have a headache, we go. We don't want to evaluate our heart before the chest pain. By the time the chest pain happens, you're already looking at a huge iceberg. Because the tip of the iceberg is the chest pain. The whole iceberg below was that something that should have been detected 6 months, 1 year ago. So proactive yearly, quarterly health checkups, especially for those who are vulnerable. Who are these vulnerable people? Strong family history of heart disease. Father had a heart attack before 50, mother had before 60, a sudden death in the family, smoker, somebody who enjoys Instagram at night, somebody who has a very crazy lifestyle, pilot, somebody in the film industry, for example. Those are what we call a high-risk individual, and they need to start their screening much before. So screening to me is everything, because by the time the symptoms, and the symptoms can be anything, heart disease presents with jaw pain, with dental pain, with upper abdominal pain. And even for us as professionals after 20 years in the industry, it's very difficult sometimes to pick that symptom. Which is that symptom which is heart related? Because anywhere from the angle of the jaw to the epigastrium could be heart. So I don't like to wait for symptoms. I tell people proactively get your things checked. And now we have the equipment, we have the technique, we have the expertise to pick up the diseases not only early, but now we have good medication thanks to the pharma industry, where we can start you on lifestyle, we can start you on good food. There's a lot of good food available in the market, organic stuff, low sugar items, low glycemic index. We can start you on very safe drugs which are very powerful, which can not only prevent progression, but can arrest it. And now we're looking at drugs which can cause regression, that is reversal. So we are in a very unique place in the history of health, wherein we have the techniques, we have the tools, we have the ability to do this, but nobody's coming. And when people come, they don't want to listen, because there's a lot of WhatsApp university things going on. Unregulated health information about homeopathy, Ayurveda, some ointments, some oils, all these things which have no scientific basis. Babas, I didn't want to say that. They have no scientific regulation. So that becomes dangerous.
Yeah.
So I think it's important that not only as individuals, as a country, we need to get disciplined. We need to ask our lawmakers to put in effective screening things for us and for our children. We are all in the 50s right now. The danger now is awaiting the next generation of Indians who are going to contribute to the GDP, and I'm worried about them, because I get heart attacks at the age of 24, 25, 26.
Ouch.
People at the peak of their journey, education journey, their work journey, people going to start a family, getting married, and I don't know what to tell the families when I have a 24-year-old admitted with a heart attack. And many of these boys don't smoke, they don't drink, they have pretty good habits, but they're sitting all the time and scrolling. They're sitting all the time. They don't have time to cook, they don't have time to take a walk. So the traditional factors like smoking and alcohol are actually not there. To me, the big new challenge is, I call it, sitting is the new smoking.
Yeah.
Sitting is the new smoking. We are sitting all the time, everywhere.
I clearly see how that's turning out to be. However, doctor, over the years, there's a lot of medical advancements that have come up. So, for example, I want to ask, with regards to, say, cardiac imaging, how do you think this has helped the doctor, especially like you, or the hospitals, in terms of understanding a heart problem or solving the heart problem?
Yeah, so as I said before, the conventional tools, that is, I ask you a couple of questions, then I look at you with my stethoscope, maybe do an ECG or an echocardiogram, which were the conventional tools. are not good enough right now, because the disease is really masked. So we need extraordinary tools to pick up the disease early and to allow the medication and the new things that are available to cause regression. Now, the traditional tools that we're using for the last 2 decades were good for those who already came with the problem. I came with a heart attack, you did an ECG echo, you found that heart attack, you had an evidence of the heart attack, you started me on medication, or you did an angiogram or angioplasty, but my heart is already damaged. My lifespan, for example, if it was 80, is now down to 64. But cardiac imaging, which includes 3 basic tools. One is nuclear imaging, where we use a radioisotope. The second is cardiac MRI, which is a non-radiation, non-ionic radiation tool, and cardiac CT, which is what I call one of the wonders of the modern world, where for the first time the holy grail of cardiology, which is to look at the coronary arteries in a non-invasive manner without putting a catheter. Now, these are the 3 tools of cardiac imaging, and by this we are able to pick up disease very, very early. So much so that by just using pharmacological and lifestyle measures without having to use stents and bypasses, we are able to not only arrest the progression, as I said, but now we are starting to see reversal. So that's an amazing thing. But to use that, these things cost a lot of money, they require specific training, and they have to be used in the right context, because we are also seeing a proliferation of, for example, cardiac CTs in the market. They're being used as a kind of a promotional tool. Come if you are 40 and I will see your coronaries non-invasively. So this has become like a marketing strategy, which is really not good, because CT also has radiation. So it has to be used wisely, the interpretation has to be rock solid, and there has to be a follow-up on that interpretation. That if I have a plaque, there's a lot of lipid, what do I need? Do I need a good diet? Do I need an exercise prescription? Do I need a drug that will reduce the lipid component? So all these things together is cardiac imaging. Basically, we want to pick up the problem and fix it before it develops into something which we cannot manage.
In the same line, doctor, say in the next 5 to 10 years, how do you think, or where do you think is the road ahead for this?
It is going to be a huge proliferation, no doubt, simply because the market is so big. We used to see patients in our ICU about 2 decades ago when I started practice in the 60s. Then it became the 50s, 40s. And I said, as I just said, we have at least half a dozen patients who are in the 20s now. So the market is large, technology is there, more companies are entering the fray, costs are going down to some extent. Hospitals are willing to invest in this. As I said, it's a good marketing tool. So there is going to be a proliferation, and you're going to see even the tier 2, tier 3 cities also having these facilities. But the only thing I'm worried about is that it has to be used judiciously. It has to be used carefully. It has to be used as a kind of a inbuilt system, so that not only I'm diagnosing early, but I also have access to good treatment in the same way. So just doing a scan has no meaning, but doing the scan for the right patient at the right time, using those results to make sure there is disease modification happening and that you're preventing a future heart attack or stroke. So all this together integrated is cardiac imaging. And cardiac imaging generally means non-invasive. So it becomes easy to use in a population, it's very safe, and of course it's becoming more affordable. So we have to use it diligently, and we have to be careful about the guidelines when we use it.
Also, doctor, I see a lot of people, we keep hearing things like, oh, we thought it was just gas, or he thought it was just gas, but ended up becoming a heart attack. This is like I'm sure you would have heard this so many times. Is there a solution for this? Is like a one-stop, full stop for this?
Yeah, as I said before, heart disease can present anywhere from the angle of the jaw. So I've seen a couple of patients who have gone to multiple dentists because of jaw pain, tooth pain, and finally the dentists have checked and all 3 of them have said, no, there's no problem. Someone even removed somebody's tooth, which was actually healthy. But then when they come to me, I did a cardiac imaging sort of a protocol, and I found he had severely blocked arteries. So cardiac pain, as I said, is one of the greatest masquerader of the 21st century. It can present in all myriad ways and myriad forms. So it's very, very difficult to put a label on to some of these symptoms that people come with. So we are very particular, and I said that before, that a vulnerable patient, and I already defined that patient to you, has to get screened at regular intervals by somebody who's competent. Otherwise, we'll always be chasing shadows and mirages. And we will be losing we'll be missing the bus, we'll be getting heart attacks, our hearts will get damaged, we'll be more in the hospital than in the workplace. And sadly, that doesn't augur well for a country which wants to get into the 5 trillion economy.
Also, Doctor, now that you've told us so many things with regards to, say, the lifestyles, the preventive measures, and also things that are slowly becoming a problematic issue with regards to heart. Is there, I don't know, if you can jot it down to say or narrow it down to one piece of advice you think everyone should follow from the horse's mouth, which is you, with regards to the health care or heart care?
Yeah, as I believe that one size doesn't fit all. So I think it's very important that after a certain age, and I'm putting the age out at 17, which is when most of our boys and girls go to the university, and they go with a plethora of forms, their 10th, their 12th, their Aadhaar card and everything. So at that time, that's a great opportunity at a national level that before you enter any university, you need to have a health checkup, which would involve a blood pressure, very simple, a sugar, very simple, and one cholesterol. Diabetes, which is sugar related, hypertension, which is BP related, and hyperlipidemia, which is cholesterol related, are the 3 biggest killers and drivers of heart disease. So if you can identify these 3, and it's very easy to do, and there are a whole lot of NGOs and companies which are ready to step in, even if the government feels it's a lot of money, you're going to prevent almost 30% of the future heart diseases.
Oh, wow. Doctor, now that we've spoken so much with regards to the heart, I have some quick fire questions. We're calling it the rapid care round. All right. I want you to answer them in a word or a line if you can, please. All right. Can we start?
Sure.
This is rapid care. Okay, let's go. One food that is good for the heart, bad for the heart.
Rice, bad for the heart. Nuts, good for the heart.
Okay. Early bird workouts or evening walks, which is preferred?
If you are an elderly person and you have time in the evening walk is good. If you are an individual who works late in the evening, early morning walk. Both are good. Depends on who you are.
A heart health myth you wish everyone would stop believing?
Your grandmother's recipes.
No, amama avakailo. Okay. One thing you do daily for your own hearty health or healthy heart, sorry.
Walk, and walk.
How many kilometers do you walk, doctor?
About 5.
Every day?
3 kilometers is already in the hospital, going up and down. I don't use a lift.
Okay. Coffee, a friend or a foe for the heart?
Black coffee, great. With milk, bad.
One medical advancement you're most excited about right now?
Low radiation coronary CT scans. Low radiation CT scans. They look at the heart very early and give you a lot of information.
All right. One test every person above 40 should definitely get?
One treadmill.
Okay. One innovation in cardiology you wish existed already?
Handheld instrument for lipid, sugar and blood pressure.
Okay. Most underrated habit for a strong heart?
Discipline.
It is very, very overrated. Okay. Yoga or cardio? Which do you think works better for the heart?
Both are good. Yoga is good for the elderly and cardio is good for the young.
One word to describe being a cardiologist in India?
Stress and more stress.
What's more stressful, blocked artery or blocked calendar?
I think block calendar. Arteries are easy to open.
Okay. A health gadget that's more marketing than medicine?
Smartwatches.
Is that smart ring, is that good enough, doctor?
It has to be looked at by the right person. Okay. Data is good, but the data has to be seen by somebody and acted upon. That's where we are having a problem. We have got endless amounts of data now. From the lab reports, people have access to fantastic labs now. Everything is online. you get home collection. But who's going to look at it with that eagle eye and then tell you what you should do and shouldn't do? That's the big challenge.
Have you ever diagnosed someone during a wedding or a party?
Definitely, a good number, half a dozen of them.
Another thing, doctor, they say, no, ghee won't cure your heart blockage.
Certainly it doesn't.
Doesn't?
It makes the blockage even more complete.
Google told him it was gas, but it was a heart attack.
I think we better stop this Google business. We're just giving our money to somebody else across the Atlantic.
That's it, doctor. Now I've made a promise to myself. I'm going to eat very, very moderately. I'm going to walk back everywhere. Walk home, walk to my hometown also. That's my promise, doctor.
You live forever.
I live forever. Thank you so much. We had a great time, doctor. So the next time we have any doubt with regards to heart, we will come back to you. Thank you so much.
Thank you.
Good luck to you, doctor. And thank you so much for doing this with us.
Thank you.